Hi everybody, if you're new to my channel, my name is Darwin. I'm a licensed physical therapist and I am the Smart Ortho Coach. Now in a previous video, what I did was I demonstrated 3 of the most important exercises before a knee replacement surgery. If you haven't seen that, I'll put a link down below. Watch that first. You'll probably get a little bit more out of it than this one because what I'm doing in this video is I'm going to advance all 3 of those exercises. They're going to be just a little twist on each one of them that make them just a little bit more advanced. So again, if you're new, you're having a knee replacement surgery, go watch that other video first, try those exercises, and if you feel like you want to improve them or step it up just a little bit, come back and watch this video because that's exactly what we're going to do in this one, is just put a little spin on those 3 exercises. These are still 3 very important exercises before your surgery to help give you a better outcome and really improve the recovery time. Let's go. This exercise is a different version of the hamstring stretch, which we did in the first video. And if you recall, I was lying on my back using a strap. With this one, we're not using the strap. But you're going to set up the same way, lying down on your back. Your opposite leg is going to be flat on the ground. Now you're just going to use your hands, interlace your fingers behind the knee. And from here, what you're going to do is just move or extend the foot up. Feel that stretch in the hamstring, and then right back down. So these are more dynamic hamstring stretches. And so what we're doing is stretching the hamstring through the full range of motion, which is a little bit more effective than a static, just hold that position. You're going to cycle back and forth 10 times and then switch over to the other side and do the exact same thing 10 times. You can see how tight mine are. And you're going to do each side 3 times or 3 sets of those 10 repetitions. In the first video, we did quad sets, and basically that was just to activate the quadriceps muscles. In the first video, if you watched it, you'll see that I used a towel underneath my knee for that exercise. For this one, that one's not going to work. So with this one, you do want to use something more substantial underneath your leg, like a volleyball, for example. Would work, but we're not going to use that one. For this, I'm going to actually use a foam roller. So you're going to put that underneath your knee, set it up just like you did with the previous video. Opposite knee is bent up. With your knee supported, what you're going to do is press down, activate the quad, just like you did in the first video, the quad set. You're setting the quad, you're firing it, you're seeing that muscle contraction. Now from here, you're going to maintain that quad contraction, but now you're going to lift your heel straight up in the air so your leg is nice and straight. So it's going to look like this. Tighten the quad, do your quad set. Now heel comes up until the leg is straight. We call these short arc quads or SAQs. It's an exercise you'll most likely be doing after surgery as well. So fire the quad, lift the leg straight up, and right back down. Now if your hamstrings are as tight as mine, you might want to do this lying down on your back. That's fine too. Just make sure that you keep the quad engaged as your heel comes up and down. And let's do 3 sets of 10 repetitions with this one. For the last exercise of this more advanced routine, we're going to do the leg kicks like we did in the previous video. Only this time we're going to add a little bit more motion to it. So you're going to set yourself up the same way with a chair or a stable object. Could be the kitchen counter. Just something to maintain your balance with. You're not supporting your weight. Your fingertips are just there for balance. From here, what you're going to do with your affected side, the side that's going to have the knee replacement, you're going to kick the leg out and to the side. Now, rather than bringing it back in and just going straight out and back as we did in the first video, what you're going to do is kick your leg out to the side, hold it here, and now you're just going to draw little circles with the heel. Try it 5 times going clockwise, and then reverse and go 5 times counterclockwise before you return the foot back to a standing position. You're also going to want to do this on the other side, the good side. So now it forces the side that's going to have surgery to stabilize the body as your other foot comes out. Again, kicking it out and to the side. And then with the heel, just think about tracing small circles clockwise 5 times. And then reverse it and go counterclockwise 5 times. So try this 5 times with each leg. See how that goes. So those were 3 more advanced exercises going into your knee replacement surgery. I hope you found those a little bit more fun than the easier exercises, but if they are too hard for you, if it does cause pain and your body just isn't strong enough, it's okay to go do the other video where it's a little bit easier and more basic. That's fine. You're going to benefit if you do any one of those protocols. I wish you nothing but success and good health. Good luck on your upcoming surgery.